Okay. Good evening and welcome to this public meeting of the Standing Committee on Social Development. My name is Jane Wayallen Armstrong and I am the MLA for Mofi Clinton Region and Chair of the Standing Committee on Social Development. I will now ask members in the room and online to introduce themselves for the record. Starting with Mr. Tester.
Kieran Tester, member for Range Lake.
Danny McNeely, Satu MLA.
George Nersu, MLA Mackenzie Delta.
Julian Morse, MLA Frame Lake.
Shauna Morgan, MLA for Yellowknife North.
Cheryl Yakalaya, MLA for Decho.
Okay. For online,
Robert Hawkins, MLA for Yellowknife Center, and as always, happy to be here. Thank you.
Kate Reed, MLA Great Slave.
Okay, thank you, members. Okay, today we will receive a briefing on healthcare sustainability and accountability from the Premier and the Minister of Health and Social Services. This briefing kicks off committee study on healthcare sustainability and accountability that will be undertaken over the next several months. So please note this meeting is being live streamed to the Assembly social media channel. I would like to remind all members and witnesses to direct all questions and comments to myself as chair and wait to be recognized. Thank you. So I will now pass it over to Premier. Please proceed with your presentation.
Thank you, Madam Chair. Thank you for the invitation to present on healthcare sustainability. With me tonight is Minister Lisa Semler with the Department of Health and Social Services, Deputy Minister for the Department of Health and Social Services, Joanne Chiquetto, Associate Deputy Minister of the Healthcare Systems Sustainability Unit, Terence Coutre, Assistant Deputy Minister of Finance, Policy and Planning for Department of Health and Social Services, Jeannie Matheson, who I believe is joining online, Executive Director, Healthcare Systems Sustainability, Jennifer Young, my Ministerial Special Advisor, Ronna Sherrigan, Minister Semler's Ministerial Special Advisor, Ali Kincaid, Health and Social Services Deputy Minister's Senior Advisor, Haley Maddow-Young, Joe Dragon, Principal Secretary, and Kyla Caffey-Scott, Deputy Secretary. As members already know, the landscape of the health and social services system is changing rapidly, and while we continue to expand our service delivery to address this challenging environment, we are in a position where the government's fiscal framework is challenged to match the costs to deliver on these fronts. Not only do we need to think differently about how health and social services are delivered, but we also need to understand what programs and services are core to the Northwest Territories. To assist with these efforts, I recently created a Healthcare Systems Sustainability Unit within the Department of Executive and Indigenous Affairs. Sustainability for the healthcare system is not a new concept or conversation for the GNWT. Assemblies before us have undertaken different initiatives to try to tackle this issue. However, what we have not asked ourselves in any of these processes is what is core to the NWT's health and social services system. Understanding this need, what it costs, as well as its operational requirements will be fundamental to achieving sustainable healthcare systems. To fund this work, we have been able to secure federal funding through the Territorial Health Investment Fund, which is a federal fund. This funding will fully offset the costs of this new unit, and annual contributions have been confirmed until March 31st, 2028. My expectation is that the work of the unit, once complete, will yield financial benefits for the NWT. But like many other mandate commitments, the planning and analytical work that is needed upfront will take some time, and we need to have the patience to ensure that we have the best evidence in front of us before making any financial or operational decisions related to the sustainability of the health and social services system. But I want to be clear, this is not another plan or a strategy, this is the work. We are starting the work and we have a unit to see the work through. Thank you, Madam Chair. I've asked officials to prepare a short presentation that summarizes how we got here, the current financial system or situation of the health system, and how the new sustainability unit will focus its work towards addressing these challenges. With your permission, I would like to turn to Minister Semler to provide her opening remarks before we begin the presentation. Thank you, Madam Chair.
Okay, thank you, Premier. Yes, proceed, please.
Madam Chair,
As you are all aware, our health and social service system is facing significant financial challenges. While these financial pressures are not unique to the NWT, our remoteness, high costs of medical travel, and reliance on southern jurisdiction magnifies the challenge, particularly with the national shortage of health professionals and significant inflation impacting the cost of materials and travel. Despite ongoing efforts to find savings and efficiencies, the reality is that small gains are often offset by rising costs and new demands for services. That's why we must consider making big changes to bring our health and social service system into a more sustainable path. One key issue we must address is ensuring that we are appropriately funding the services we expect to deliver, that our financial resources, our resource allocations align with the actual cost of delivering services in the territory, and that we are clear in what services we expect to deliver and where we expect them to be delivered. This will allow us to provide effective service while also managing our financial responsibilities. The Department of Health and Social Services is pleased to have the support of the new Health System Sustainability Unit as we collectively work towards sustainability. And I am pleased to be here today to talk about the path forward. This work will take time, but I believe it will secure long-term financial health of our system while continuing to provide high-quality care for all NWT residents. Thank you, Madam Chair.
Okay. Thank you. Okay. Okay, yes. Premier.
Oh, Terrence is on mic. All right. So with your permission, Mr. Kuche will take us through the presentation. Thank you.
Thank you, Madam Chair. For the first few slides, Ms. Chiquetto with the department will lead us through, and then I'll speak to the last 4 or 5 slides in the deck. Thank you, ma'am.
Thank you. Thank you, Madam Chair. So the 4 key objectives for our presentation is to provide a background on, to bring people up to speed on how we got to be where we are today. So we'll provide some background on the work that we have done around sustainability. What are the impacts? What are the things that have contributed to some of the issues that we have been facing from a financial perspective? We're going to summarize the current system deficit situation. What are the cost pressures? What are the things that have contributed towards that? And then, as Mr. Coutre had mentioned, I will then hand the presentation over to him, and he will provide us with information around the purpose of the healthcare system sustainability unit. And then, of course, we will end with identifying what the next steps are. So if we can move to the next slide. So the accumulated deficit within the health and social services system has resulted from annual compounding impacts that have what we would call reoccurring drivers. We're often asked what are the reasons we are having some of the financial situations that we have. What are some of those drivers? So some of those key drivers are the health human resource costs. For example, those are often increasing on an annual basis, but some of the key pieces around that are around any of our agreements that we settle, whether they are a collective agreement for staff or as well as our agreements, for example, for physicians. We also have physician services that continue to rise in our territory. We have accommodations that we provide for our locum or temporary staff. We have unfunded force growth increases for things such as price increases, volume increases to be able to provide the services across our system. We have often have unfunded service enhancements that come about on a year-to-year basis, and just generally they're often offset by we can't keep up with in the sense of trying to offset these pressures with the additional funds that we get in our system. One of the things that we absolutely acknowledge, and I want to be able to say this here today, is that we do know that the health and social services system does regularly take the largest portion of supplementary and forced growth funding in the government of the Northwest Territories. And unfortunately, it is not sufficient within the limits of the GNWT resources to be able to address our ongoing growth and needs within our health and social services system. And this is also further compounded by the fact that we have very limited opportunities within health and social services to generate revenue. And we often, there's often times where we don't have necessarily the support for changing the way in which we deliver services, whether that would include a fee, for example, or in other jurisdictions, we know that people do pay for services that we provide free in this territory. And I want to note that when I say we don't have a lot of support for that, or there's a limited appetite for that, I want to note that that is not, this is not just about political, it's not about GNWT. It includes our clients, it includes the people that work in our system, whether it's the staff or the practitioners. It's very difficult to change, as you would know, in probably any system, that once you start to deliver something, to try to change how you do that is often quite challenging for systems. So health and social services is no exception to that. And so we do have pressures around public demand and political demand. We also have demands within our, for example, standards of practice continue to change on a regular basis. Those things contribute towards an ever-changing fiscal reality within health and social services, unfortunately. And so we have an ever-changing environment. Some of the things that also contribute to that, as I just mentioned, is recruitment and retention of our staff. And things such as the use of agency nurses. This government went almost 20 years without using agency nurses, and in today's reality, we've had to use that resource, which is costly to our system. I wanted to also talk about some of the things that actually have been distracting to the health and social services system that actually draws on the capacity for us to be able to address the root causes of the deficit. So for example, our system operated in 2016 in August when we created NTHSSA as an example on a no net new premise. And so we created NTHSSA with no additional resources. Some of the other things that have continued to distract us from being able to identify some of the root causes, and I'll just name a few of these significant issues. So in 2019, we have a new Stanton Territorial Hospital was opened. In January 2020, even though in 2016 we came together with 6 health authorities to form the NTHSSA, they were all operating on different financial systems. So to bring all of those health authorities in those days, the prior 6 authorities, into the one NTHSSA, it took a great deal of resources, both financial, human resources, and time to be able to bring everybody onto the same financial system. So that's an example. Of course, none of us can forget the 2 years of the pandemic. And then, of course, following the pandemic, we have had a number of emergencies, whether they are fires or floods. And so, of course, there were those circumstances that drew us away from some of the work that we would have been doing on a regular basis. And then, of course, we do have a national recruitment and retention challenge. I would just add that I've had the privilege of working in this jurisdiction for over 35 years as a clinician, and I have not experienced the degree of the recruitment challenges that we have faced in this country than we do today. So inevitably, our costs do exceed the available funding. We do work, of course, in collaboration with our colleagues in the Department of Finance. And some of the things that we have been doing to try to counter the issues that contribute to a deficit, as an example, are things such as looking at our surplus deficit retention policy. We've looked at portions of our funding in relation to the accumulated deficit and funding portions of that accumulated deficit. We've done a zero-based review at Stanton. We have removed restrictions, for example, on deficit budgets, and a number of works that we have done with FMB around the deficit reduction plan. And so those are just a few of the things that, of course, have contributed to the situation that we currently are today. So the most recent work on the next slide that we have been doing in relation to health and social services sustainability is that in 2017 we were given the direction to create a health and social services system sustainability plan. And we were able to create that, and in 2020 we approved the system sustainability plan, which was a multi-year and a multi-tiered approach to addressing the financial challenges that we're facing our system. And so we have continued to provide regular updates, of course, to FMB, and the latest update would have been this past summer in July. In addition to that, we also had actions and options within this plan that were not necessarily, what we talked about was not necessarily, this plan was not to address the existing accumulated deficit. It was really not about eliminating that accumulated deficit. It was really looking at mitigating as we go forward. What are the things that we could do from a further cost growth? So just to give you there's three tiers to that plan. Tier 1 were activities that focused on internal controls and cost containment initiatives. Tier 2 activities were to be focused on operational review and quality improvement. And then Tier 3 were focused on funding and service level reforms to align with our current and projected demands for services. Since 2022, with the support of the Territorial Health Investment Fund, which the Premier also just mentioned, which is funding Terrence's team, a System Sustainability Office was established within NTHSSA. And we had a steering committee that was established to oversee that work, and it included myself as Deputy Minister for Health and Social Services. It was the Deputy Minister for the Department of Finance, and also the CEO of NTHSSA. All right. The last thing I'm going to mention on this slide is that Minister Green, in her time as minister, also directed the department and the system to create a deficit recovery plan, and so that was established as well. So if we move on to the next slide, this slide is the last one that I will speak to. In a nutshell, the accumulated deficit is $265 million as of this past end of our fiscal year in March 31st. The budget for this current year is totaling $61 million deficit for 24-25, and that's that second bullet. We are forecasting as currently at the end of quarter one a $72 million deficit. In addition to that, I do want to point out that the Department of Health and Social Services is forecasting a $21 million deficit for 24-25. So the total for this current fiscal year is $93 million deficit. And so unless we get additional supplementary funding or the drivers of our deficit in some way, shape, or form change, we are anticipating a $93 million deficit in this current year. So that would be that we are moving into the next year with a $93 million deficit or a shortfall for 25-26. That's a lot of detail, and I will hand it over to Mr. Coutre.
Yes, please proceed, Mr. Coutre.
Thank you, Madam Chair. You said it perfectly. Good evening, members. As members already know, and from the Premier's opening remarks, the Healthcare System Sustainability Unit was created this past July. And as part of the 23-27 mandate and the Assembly's priorities, the main goal of this group is to develop an evaluative approach in defining core programs and services within the health system with an objective of improving fiscal sustainability and exploring opportunities for greater efficiency. The scope of this work will also include an evaluation of programs and services that are insured or not insured under the NWT system. The details of this work will include designing and implementing project plans for each program and service being reviewed. And as members already know, the conversation around health sustainability is really not unique to the Northwest Territories. This conversation is happening with other provinces and territories across the country, and we want to be part of that conversation as well. So we plan on doing some jurisdictional scans and engaging with other PTs to learn what they're doing and how they're tackling this challenge. We're also going to be reviewing and aligning existing financial processes as part of the scope of our work. And lastly, we want to obtain feedback from frontline staff and operational managers and get their input in towards areas for improvement and identifying core services for the NWT. It goes without saying, but certainly worth noting, that this work will require careful coordination with the Department of Health and Social Services, as well as our 3 health authorities. And of course, any proposed changes as a result of this work is going to be brought forward in the form of a recommendation. And if required, the new unit may also assist with implementation of these decisions at the appropriate time. Resourcing for this unit includes proposed funding of approximately $2 million per year for the next 4 years. This funding is being offset by a contribution agreement with Health Canada through the Territorial Health Investment Fund. This contribution agreement provides in total about $10 million per year to the Department of Health and Social Services. That targets a number of funding priorities, of which health system sustainability is one of those areas. Approximately 80% of the proposed budget is for compensation and benefits for 9 positions. The remaining 20% is for related O&M, which could in part be used for contract services to assist with specific projects as needed. Of the 9 positions identified, 3 positions support senior leadership roles, consisting of myself and our executive director. The remaining 6 positions will support program reviews that possess a combination of skill sets consisting of policy development, clinical expertise, program evaluation, and financial analysis. Madam Chair, in performing this work, clarifying roles and responsibilities will be important. As a first step, a scoping document is being prepared in concert with the Department of Health and Social Services and the 3 authorities. This is largely a document of who's doing what, vis-a-vis other sustainability initiatives identified in the mandate priorities. As part of our work, the new unit will have 3 main functions. The first is to establish a core service inventory. Again, we want to better understand what programs and services are currently being delivered to inform further analysis if those programs and services should be core to the NWT. Second is to gain a better understanding of the budget oversight and accountability. Through the core service inventory work, it's anticipated that we will likely find opportunities to improve budgeting oversight or to improve financial processes. And lastly, continuous improvement. We want to ensure that the work we're doing will be sustainable over time and includes ongoing monitoring and evaluation. Madam Chair, this is our last slide, but in terms of accountability and next steps, the work being performed by the Sustainability Unit will follow a project management process where regular updates will be available. The new unit is required to develop a monitoring and evaluation framework that's due by the end of this fiscal year. So as part of this work, we will be providing regular updates every 6 months on progress and any lessons learned. In the meantime, we're currently working to staff up this team with the positions previously noted, and we're working to mobilize as soon as possible. We've also been invited to give similar presentations like this one tonight to the various regional councils and also to the Leadership Council. Those presentations are currently being scheduled, and we expect to have those conversations in the coming weeks. Thank you, Madam Chair. I'll turn it back to you and our ministers.
Thank you for the presentation. I will not ask the member if they have any questions. Ms. Morgan?
Thank you, Madam Chair, and thanks to each of you for coming. I think this conversation might be long overdue, but I also know that it's been taking a while to get the unit up and running. My first question is around how you plan to get feedback from frontline and operational staff. That's one of the tasks or areas that you've identified. And I just wanted to flag too that what I have heard from staff is that they feel that a lot of data is actually already being collected from them, various kinds of engagement, staff surveys, this kind of thing. But there's frustration that the sense is that all that data seems to go into a black hole or isn't necessarily analyzed or acted upon, and it's at least unclear to staff where that feedback or engagement, what the outcomes of that are. So just want to flag too, like both how are you going to newly engage staff, but also how are you going to use existing information and over the past few years, information that's already been collected. Thank you, Madam Chair.
Premier or Minister? Okay, Mr. Kutrig?
Thank you, Madam Chair. We plan on using a few different mediums to engage with staff. First is to develop a data collection plan. So we want to, as we work to review our programs and services, we want to make sure we're talking to those frontline employees or those operational managers who have a bit more of a closer look or an intimate knowledge of how their financial processes work and how the resources are dispatched. We recognize that there's been a fair amount of work done in the past, and I was involved in the data collection of employee feedback for restoring balance as an example. We want to use those earlier mediums where employees have already provided some input. We have a copy of a letter from the Medical Association as well. We want to take some of those comments into account, careful to not repeat work that's already done, but also give employees an opportunity to provide input when and where appropriate. Madam Chair, we also have we've created an email account as well, and we're communicating that out to all of the health employees. It's been in circulation now for about 3 weeks, and slowly it's starting to gain momentum, and employees are starting to use it. So I'm happy to report on that front as well. Thank you.
Thank you. Ms. Morgan, do you have a follow-up question?
I do have a follow-up, thank you. So I know that staff often feel that they're not supposed to sort of talk outside the proper channels of sort of authority, or they're supposed to go to their manager, whoever, but is this an exception to that in the sense of staff should feel free to share whatever concerns or ideas or input they have, freely, in the sense of they don't have to get approval from their manager first before they're allowed to talk to you? How will you sort of assure staff that this is something that they can freely participate in? Thank you.
Okay. Ms. Premier?
Thank you. As Premier, I encourage staff to freely participate in this engagement with the Healthcare Sustainability Unit. There is an email address, as was mentioned. They are more than welcome. They are encouraged to reach out through that email address. Thank you.
Thank you. Mr. Testart?
Thank you, Madam Chair. So how will the results of the this new unit differ from the Systems Sustainability Office, the Deficit Reduction Plan, the HSS Systems Sustainability Plan, the Stanton Zero-Based Review? Like, a number of these things have taken place in the past. So what makes this initiative different and substantially different from those that have come before it, and that will actually turn a difference on the fiscal sustainability of the healthcare system? Thank you.
Premier or, okay, Premier, yes.
Yes, thank you. And so there have been a number of initiatives, and that was mentioned in the presentation. There hasn't been one where there was essentially an outside entity, outside of the health department, with the sole purpose of going in and looking into the system, defining what are core services. We offer a lot in the territory. Sometimes we get federal funding for a program that the feds want to run, and we start running that program, and that federal money runs out, and we continue to run that program. Is that something we need to do? We really need to look at ensuring that we are able to deliver the basic services that all residents expect. And we have not had an opportunity to have a holistic look at that. Often, some of the work that's been done in the past in terms of sustainability, there's money injected into the system for sustainability, but those positions, those duties get absorbed into the broader work of the department on a day-to-day basis or the authority. So this is something that is distinct. It's also the reason that it, the way I see it, the reason that it's through my office is so that there is some teeth to it, and there's follow-through. But I can hand it to Mr. Coutre for further elaboration. Thank you.
Mr. Coutre?
Thank you, Madam Chair. I think the Premier covered it really well. There's really two things that's going to make this fundamentally different. One is dedicated resources, and the second is a focus on what those core services are. If we can get a better understanding of what we're currently delivering in terms of programs and services, and we're also looking at social services, it should be noted, and look at that with the lens of what should be core to the NWT, I think what I'm expecting to see is a delta between those two lists. And it's that delta that we're going to need to analyze to see, try to quantify the differences of delivering those core programs and services, and put some analysis to that to see if those are services that we should continue to deliver. Thank you.
Thank you. Mr. Chester, do you have a follow-up? Okay.
Thank you. So my fear, I guess, in hearing this, and I completely appreciate why this kind of service creep, due to what the Premier mentioned with new federal programs and fundings leading to more services that then become unfunded. But my concern here is that there will be what this sounds like is we'll take an inventory of everything we do, find out what we're required to do, what territorial insurance requires us to do, and start to phase out the rest of it, and that's just going to lead to kind of a messy fight over which services go and which ones stay. And we can have an evidence-based blueprint on how to make things more sustainable, but at the end of the day, it's not going to make people happy. It's just going to be a reduction in services, but a more sustainable system overall, and that's the trade-off. And we're here to make tough decisions. We're elected to make tough decisions, and sometimes you can't make everyone happy. But is that where we're heading with this exercise, in a nutshell? And again, I'm not trying to. This isn't to be pejorative or anything like that. But it seems like that's the end product of this. Is going to be like a leaner, meaner health system we can afford, but a greatly reduced suite of services that we're providing to Northerners. Thank you.
Premier, you want to answer that?
Thank you. And I won't predict the outcome. But if we're offering services, we're offering the Cadillac of services. Maybe we don't offer the Cadillac of services anymore, but we do the Ford Focus of services much better. So, one of the few priorities of this assembly is to ensure basic health care. Residents have access to basic health care, and that's what we want to do. And if it means that we have to take funds from one area that's a nice to have and put it into something that is necessary for health care, then this is how we're going to identify that and make sure that we can do that. Thank you.
Thank you. Mr. McNeely?
Thank you. Thank you, Madam Chair. I'm really glad that this new initiative just started, and I believe that statement was made in July that this unit is going to be up and running, and call it a task force. In this case, we're calling it a unit to help do research and make recommendations ultimately to better improve our system. And part of the research, I guess, are you going to include the last Auditor General or the Auditor General's report? They always have a set of recommendations how to improve your system. So more views and more information to improve the system is good as part of doing the research. Similar to what we're doing in the Sawtooth to fix our high fuel price. And it still disturbs me that, you know, we have a huge problem. There's all sorts of red flags. Surprisingly, one of the colleagues of mine showed me a chart supplied by the department on the amount of medevacs out of the Sawtooth. The red flag is that in 3 years we had 448 medevacs out of the Sawtooth. So you kind of think, okay, how many of that is drug related or elders or accidents? I know of a few, but if we can eliminate that to 200, then we're really achieving. And you know, this is an all of government approach and all of community approach as well. So I'm really glad to see that you're going to be making a presentation to the regional wellness councils. And if you come to the Sawtooth there, I wouldn't mind if you extend me an invitation. I wouldn't mind to participate. So you know, we recognize there's a huge problem. And labor shortage, I hear that constantly when I talk to the business community. And this government as an employer is facing that same challenge. So you have a huge task ahead of you to help improve our system. And my question is that are you going to engage the Indigenous regional organizations? Thank you, Madam Chair.
Thank you, Mr. McNeely. Mr. Coutre?
Thank you, Madam Chair. Yes, that is the plan, to engage the regional councils. We're going to start with the Leadership Council, engage with them. We've already scheduled some timelines to travel down the Hay River. We've been invited to travel to Betchico to talk to the TCSA. So those conversations are happening, and we're gaining a little bit more momentum now to get out and talk to those regional councils. Madam Chair, and I think there was perhaps one other question in there, and that's how are we going to use some of the previous audits and some of the work that's done, and fully recognize, I think the last audit report that I'm aware of was in 2011, and I think there might be even 2 more audit reports before that date. We're already reviewing that material, the sustainability plan, the deficit reduction plan, and not to sound too repetitive, but the plan is to not repeat that work. We want to leverage that material and do the work now. It's not about creating another review or another study. It's about doing the analysis now. Thank you, Madam Chair.
Thank you. Mr. McNeely, do you have a follow-up question?
Thank you, Madam Chair. And part of the elimination of costs and problems with staff retention and so on, are you going to be having a component in your final result to have a hiring policy or a retention policy? And please include education as part of that. I think if we can target our youth, that we need more doctors, we need more practitioners, we need more LPNs, and that might or will help. Thank you, Madam Chair.
Yes. Premier?
Thank you. And I want to temper people's expectations. This won't be a catch-all for all of the health issues. And so when it comes to things like recruitment and retention, I don't foresee the healthcare system sustainability unit having a focus on that. You know, there's work going on in finance, there's work going on in the Department of Health. This is going to be more the identification of programs and finding efficiencies. Thank you.
Okay. Thank you. Okay, one more.
Thank you, Madam Chair. I'll just make a suggestion or a note. One of the things I really want to do here now that we're entering in our seasonal affordability winter road travel system or season is work with the Department of Education there to harness the tradespeople that came out of the Sawtooth. I was very surprised when I was talking to many individuals. Our Supreme Justice is from the Sawtooth. James DeSilly is a medical doctor from the Saudi. And a young fellow there got his journeyman linesman, and he's working for the Power Corporation. And we have a journeyman electrician. So we got a bunch of identified individuals out there that could be really role models for the importance of education and passing that on to the high school students. So I just share that there's some promotional education steps that we as individuals could help out as well. Thank you.
Thank you. So that was more of a comment. We'll go to Mr. Morris.
Thank you, Madam Chair. Yeah, I wanted to just start. In March, the NWT Medical Association, as you guys are, I'm sure, all aware, or folks, released their Restoring Balance report, and it had a suite of recommendations in it for improving system sustainability. Most of them did not focus on looking at our service levels and whether we need to reduce them. So there was a number of recommendations in there. One of their top ones for saving money was medical travel. So I'm just curious to know how this review relates to that, how this review is kind of looking, like, are we just looking at ways we can reduce the amount of service, or are we looking to kind of create sustainability in the system in terms of saving money in various ways that we could look into it? If you could just kind of clarify that, because it seems like what we're looking for is just service reductions, but I'm wondering if there's more nuance to it than that.
Okay. Premier?
Thank you. The latter. I think the way the member phrased it, it was are we looking for service reduction or finding efficiencies, making the system more sustainable? That's what we're trying to do. Not just, I don't need a unit to find reductions. We can make reductions. It's easy to just cut programs. What we want to do is look at the programs as a whole. You know, the health and social services system, it's grown due to many of the factors that were discussed earlier, almost unchecked. A lot of that is because people are sicker, costs are escalating, and there's things that are beyond our control. But the system is so large, we have not had that type of oversight that this body will provide, that the system has sort of grown beyond the scope that it should be, and we don't really have a handle on what we offer, why we offer it, and how we're offering it, and how we're affording to pay for it. And so that's what we're trying to get a grip on. So it's not just cutting programming, it's figuring out how do we get to the point where we're offering the basic services that everyone needs in a sustainable way. If we can offer anything above and beyond that, that's great. That's the ultimate goal. But it's ensuring that we have a sustainable system. Thank you.
Okay. Mr. Morris, you have a follow-up question?
Yeah, thank you. Yeah, I just wanted to note that because I thought Mr. Testart made a good point, and that is just that, you know, when it comes down to it, there's low-hanging fruit to be found in terms of, you know, service reductions are going to be where there's going to be a bunch of political fights, right? And so, to a certain extent, it's always good to just see how much money you can save without getting into a big, you know, and it's not just going to be political, but, you know, we're going to be hearing from people, and you're going to be hearing from people, and there'll be a lot of noise. And if we can find ways to do this without reducing the services we're offering to the best extent possible, that'll be great. I mean, the goal is saving money here. It's not, I just want to kind of highlight that, you know, if we try to go for service reductions first, it's going to be a lot harder to implement, and we should consider anything that doesn't reduce services as low-hanging fruit. To get to, yeah, and I would appreciate kind of more of an answer on the Restoring Balance report in general, because I thought they made a lot of good suggestions in there, and I haven't seen us kind of have kind of a fulsome response to that yet. A point I wanted to make, just an observation. I mean, over the past number of years, I've watched us build a brand new hospital, convert Stanton to long-term care. You know, in the capital budget right now, we have 4 new long-term care facilities proposed just being built this year. You know, it seems like we're expanding a lot. So do we have policies around system and service expansion? Do we have kind of ways of analyzing whether we're going to adopt something new and how to kind of control that? Or is the current practice pretty ad hoc? Like, how are we determining whether we can even afford to expand services?
Premier?
Thank you. You're making a great case for, the member's making a great case for this unit, because that's exactly what we're looking for. So it is ad hoc. Services are expanding. And personally, I've been in cabinet now for 5 years. I don't have a grip on the healthcare system and its expansion. I think that I have a pretty good grip on how government works now and how we operate. And this is one area that has grown, and that's really the impetus for this sustainability unit, because this is, I'll leave it at that. I'm just going to keep repeating the same thing, but yes, thank you.
Thank you. Ms. Yakalaya? Yeah.
Thank you. Thank you for the presentation. I was thinking about, well, I had a whole bunch of questions. Is this the workforce? You said there's going to be 9 staffing this unit. Will you be seconding or looking in-house to find the expertise because rather than spend money to hire other people, the department, I'm sure, has the expertise, people that have knowledge in either this department or other departments, bring them together and execute this. That's what I was thinking about. Thank you.
Okay. Thank you. Mr. Coutre?
Thank you, Madam Chair. So far, I've hired 2 employees of the 9, so we got a grand total of 3. We all come from within government. We're all Northerners. And so that's the plan, is to leverage and utilize our local skill set to the extent possible. One of the things that I have noticed as a potential shortfall in our skill set is I'm an accountant. I have some program evaluation skill sets in my group already. I have an economist. We're going to need some clinical support. And so I'm going to be working with Ms. Chiquetto and the authorities to make sure that we have the right resources and mix in this group so that we can provide that balanced approach. Thank you.
Thank you. That's good because that will save you some money there. You don't have to hire outside or spend extra dollars if you second them or move them around from one department to the next for that. The other thing was the get use of feedback from the frontline workers. That part of it is important because after all, the frontline workers are the ones that are providing the service, and their input is how you will make things work better for services that people need in the Northwest Territories. So that was more of a comment, so I'd appreciate that. If that were to happen, that would be very good. Thank you.
I do have a question as well, too. I'm glad this is taking place, and there's a difference between larger regional center healthcare to small community. There is a difference, of care. There's a difference in small communities because, the minister is from a small community as well, and there's lots of challenges. We know that, and I'm glad that you guys are taking this approach. Improvement needs to be made to meet the needs of the people, and I'm glad that you talked about meeting the local leaders and the agencies. So I just wanted to know if those meetings are going to be public in the small communities or wherever you guys go promoting this, talking about it, not promoting, but yeah. So Mr. Coutre, I think.
Thank you, Madam Chair. Initially, no, I think the meetings are just going to be with the regional councils. I'm attending their regular scheduled meetings. So I'm not exactly sure if those meetings are public, but I suspect for our portion, at least initially, they would just be with the regional councils and for us to receive some advice and some feedback from them before we start with this work.
Okay, thank you. I think we do have a second set. Okay, Mr. Nersu. Go with Mr. Nersu, we'll go with Kira. Okay.
Thank you, Madam Chair. Just on that note there, just going to the regional councils, maybe I would recommend that maybe the regional councils go to the smaller communities before you go there and get their advice, get their input from the smaller communities, because I don't receive any concerns from the regional level, but the smaller communities, it's where all my concerns come from. So it'd be good if the regional council go to the smaller communities first, then get their input to pass on to this unit here. It's more of a comment than anything. Thank you.
Okay, Minister?
And the regional wellness councils, there are members from most, and when I recently did the appointments, we have one that's from McPherson, we have one that's in Aklavik. So their role is to get the feedback from the community, and to bring, when they have meetings. So they'll be meeting, if Terrence meets with them, they'll be at that meeting. Thank you.
Thank you. Mr. Nersu, do you have a follow-up? No? Okay. We'll go with Mr. Testart and then Julia. Yeah.
Thank you, Madam Chair. So healthcare sustainability is not just about financial sustainability, it's about service delivery sustainability. So it's multi-dimensional. And we've already discussed this, that the new unit is going to focus on the financial side, but we also need to focus on the recruitment and retention side. The Premier mentioned work underway in the Department of Finance to help with healthcare recruitment. We just got a report from the HRU that's very positive. Problem with the HRU is it does a great job recruiting, that's the health recruitment unit, does a great job recruiting nurses, lousy job of retaining them. So as fast as they can recruit new nurses, we're losing them because we have this retention problem. Talked a bit about this on the floor of the House. We need a plan for retention. We need to equalize the difference between locums and people on permanent full-time employees. So while this work is going on, what are we doing to ensure that work is done? And hopefully, when we get to, the forward focus level of healthcare service, we can divert some of that excess funding into recruitment and retention. I'm for that, if we can make all this work and retain as much staff as possible, but these things have to be interconnected. We can't just have a unit that slashes services to improve the government's overall health. It needs to be something that also fixes this problem with retention. Thank you.
Minister?
Yeah, thank you, Madam Chair, and as members and the public, that we have the people strategy that will be finalized and launched in June 2025. So this, and then we have a bridging plan that will be released October 24 to highlighting the development work for the people strategy, and that is our recruitment, our moving forward, our recruitment strategy. So that is going on in the meantime as the Health Sustainability Unit will be doing their work. Thank you.
Okay. Thank you. Mr. Tester, do you have a follow-up?
Yes, can the Minister elaborate on the bridging plan, please? Thank you.
Okay, Joanne.
Thank you to the member for the question. So our previous recruitment and retention strategy ended in March of this current year. And so we're calling that a bridging plan to get us to the new strategy. It's really the continuation of those existing strategies so that we didn't have nothing, no strategic approach. So in essence, it's really what are those key initiatives that we want to make sure that we're continuing to do. So any of those things around that we had launched in our last strategy and then continue on to our new strategy. And in addition to the in addition to the old strategies, what is new in that new people strategy? So we called it a bridging plan because we did not want one, there not to be a strategic approach to recruitment and retention, or the perception is that we weren't doing something between March and this coming June.
Thank you. Okay. Okay, Kirill, one more?
Yes, thank you. Just because it's topical to this, Madam Chair, I appreciate your indulgence. So the people plan, how are you? Can you precisely tell me how you're engaging staff in that? Because my understanding from many workers is they don't feel like they have an input into what's being proposed. June is coming very quickly in the grand scheme of government, and I'm worried that frontline workers who are leaving the positions are frustrated with their current employment situations, don't feel like they can participate, don't know how to participate, don't even know this plan's coming. So what exactly are you doing to involve them, to ensure their input is respected and valued, and ultimately shapes the basis of what this people strategy is? Thank you.
Joanne?
Sure. Thank you for the question. One of the key things that I think is important to note is that we're purposeful in calling it a people strategy because it's for the people. It's not, it's really targeting the staff in an effort to also ensure that we provide quality services to the residents of our territory. So some of the ways in which we have used the feedback is from our employee engagement strategy, as an example. Any of the questions that have come through that, any of the information, employee satisfaction survey, I guess is what I should say. Exit interviews is another mechanism whereby those employees who have taken advantage of doing the exit interviews, we have, of course, included that information. Any of the information that has literally come up through the system and the organization, I would have to go back and ask the question of NTHSSA, who is leading this work on behalf of the system, is really and truly around what has been the targeted approach. I'm not sure if there were items such as focus groups, as an example, but I can go back and ask more to get more information specifically around what has occurred to ensure that the people are reflected in the strategy.
Thank you. Okay. Okay. Mr. Morris?
Thank you. So when we're looking at our core services inventory, which seems to be kind of one of the key things you're going to be doing, I just note that the NWT is quite unique. I mean, how are you proposing to go about quantifying how to appropriately determine service levels to hold ourselves to? Are you guys scanning other jurisdictions? Do we currently have service level standards for our various communities, or again, is it kind of more ad hoc? Like, are we just, communities might ask for this and that? I mean, I have to assume we have a way of determining, for a certain community size, there's a certain amount of service provided. Maybe we don't, I'm not sure. I'm curious to know, though, how we're planning to go about kind of being systematic in our work of sort of determined work.
Thank you. Mr. Coutre?
Thank you, Madam Chair. That's certainly going to be part of the work that we do in early days to try to sort out how to quantify the service levels in not only just in the communities, but for the particular programs and services that are offered. There was an integrated service delivery report done in 2004. We want to start with that as a starting point. That report was population-based. So we want to get our heads around how it worked and the results of that report, and again, use that as a starting point before we jump into this.
Okay, I think we're kind of stressed for time, so I will go to Ms. Morgan and to Ms. Yakla one more question, and then we will end the public portion.
Thank you, Madam Chair. Just as a quick preamble, Mr. Couturier, when you were talking about the need to recruit for your unit, more staff with some clinical background and insights, I was sort of sadly thinking that that might not be too hard, given that a lot of our clinical staff seem to have migrated more into the department or towards sort of the office-based positions. And a big part of the challenge ahead of us is how do we get people back into clinical work. Anyhow, my question is part of your work to create a workforce plan? So in the past, like in 2020, there was a physician workforce plan that was created. I haven't seen evidence that it was implemented in the sense of trying to match funding to what was identified as the needs for physicians. But I think going forward, we need a much broader workforce plan that includes more than physicians, like all different healthcare practitioners. I know that that will depend on the question of what our service levels are, what is core and what isn't. But I would suggest that perhaps much sooner we could start on a workforce plan, at least for, say, primary care, where, primary care is both identified as a priority of the Assembly, and it also, by definition, involves sort of basic healthcare services to the population, and so might not involve as complex sort of sorting through what's core and what's optional, and specialist services. We have core primary care. We need a workforce plan for primary care in terms of how many practitioners, what kinds of practitioners, where should they be based, and then how much will that cost us to get the right number of people in the right number of jobs. So is that part of your work? Is that a priority? And how soon? Maybe I have an answer, but to get at least a workforce plan for primary care underway. Thank you.
Mr. Couturier.
Thank you, Madam Chair. Not directly and not initially. So as we get into the work of defining our core services program, there may be policy related flags or legislative related flags or regulatory flags that we may notice in that work. And we want to make sure that we're still coordinated with the Department of Health and Social Services and also with the three authorities, so that if there's overlap in some of the areas that we're working on, for example, I think the Department of Health is potentially looking at a review of primary health care. So if there's some overlap, or if there's something that we find in our work that we can share with the department, we're going to be doing that. So again, there's going to be some careful coordination with the Department of Health and Social Services and also the three authorities with the results and the information that we find in the work that we undertake. Thank you.
Ms. Yakalai? Okay.
Thank you, Madam Chair. Some of this work ongoing, and it's important that Mr. Couturier has clinical staff within there in his team, so that stuff can be analyzed. But the work is as well alongside going on in the department. Like right now, there is a work going on to look at how the staffing models in the smaller communities are structured, and what types of healthcare providers are in those communities because of our services. And so looking at, as primary care, like I mentioned today in the House, is it's all of the primary care throughout our territory and how we're meeting the needs. And so we may have to make those changes, and those changes could be part of, that could mean streamlining some of the, and putting, instead of always relying on one type of a healthcare practitioner, we're changing even in the smaller communities to meet their needs. So that work is still going on, and it will go on within the work that's being done with and being monitored with the Health Sustainability Unit. So.
Thank you, Ms. Yakalai.
Thank you for that. I'm very happy to hear that those things are going to happen, because I have, like right now, you must be, the healthcare system is bursting at the seams due to medical travel, and we're heading to a $93 million short in 2025, so this will help. Maybe we will not reach that 93 million. So, having said that, I have communities, and you said staffing models, primary care in all the NWT communities. Well, there's some of our communities that have no health center. And these people I've got, well, you could say 3. And there's Satu and in the Beaufort Delta. Because they don't have a health center, they have somebody in the community that does that type of work. So I'm excited to see how that's going to work and how that will all work into this plan, because people calling me saying, you know what, we needed to go to Hay River, we needed to go to Fort Providence because of, we had an emergency, but they don't, it's on them to get their gas, to get their food, to get their whatever they need to go to Fort Providence or to Hay River to make sure their emergency was taken care of. So those kinds of things, if you're going to take those into consideration, that's what's needed. That's what's needed from our community. It might help with the medevacs, I'm not sure, but if you look at prevention, a lot of prevention things in the healthcare stuff, like prevention and awareness, and that will really help with all of this stuff. So I'm excited to see how this will all roll out for our communities, especially people that don't have the resources to travel to hit to the communities that have the services, and how that's going to work for them. Thank you. That was more of a comment, but I'm happy to hear that. Thank you.
Thank you. Minister, you want to reply? No? Okay. Okay, it's more of a comment. So we're stressed for time, so what we're going to do is we'll end this. Thank you for, Premier.
Thank you. I just wanted to make just a final closing comment. So, I heard this characterized as a unit to slash services. That's not what this is. This is a unit to find efficiencies, create a healthcare system that's more functional, more sustainable, a better place to work. If we have a system that is cohesive and working together, and everyone knows their roles, and a place is operating efficiently, it's a better place to work. So it's going to be better for staff as well. And most of the services offered in the territory are essential, but not everyone has access to them, like we just heard. I'd like a family doctor. It's been decades since I've had a family doctor. I come to Yellowknife to see the doctor. The member's talking about coming to my community, and I go to a different community. So the ultimate goal is to be able to offer those services across the territory where they're needed. With the current model, we can't do that. We need a more efficient and sustainable system to be able to do that. And so that's the ultimate goal here. So thank you, Madam Chair, and thank you to committee.
Thank you. Health and social services is a major issue, and I'm glad, that we're doing something about it, and I know that we have a lot of work ahead of us. So I would like to say thank you for joining us today. And so this concludes the public briefing on healthcare sustainability and accountability.